Before we begin, this video is general health education, not personal medical advice. When you cut yourself, your body triggers a precise repair process. Platelets form a clot to stop bleeding, while immune cells remove debris and new skin grows in layers. This typically takes days or weeks depending on the wound's depth. Factors like blood flow or infection risk can alter healing, which we'll explore next. When you cut yourself, platelets rush to form a blood clot, sealing damaged vessels and stopping bleeding. Immune cells clean debris while bacteria are fought off. A scab forms within hours, protecting the wound as skin regenerates beneath it. However, conditions like diabetes or peripheral artery disease can impair blood flow, slowing healing. Bacterial infections, if present, introduce toxins that delay recovery, sometimes leading to complications like abscesses. When you cut yourself, your body responds with inflammation, a targeted immune reaction to tissue damage. Neutrophils, tiny white blood cells, rush to the wound, releasing chemicals to fight bacteria and clear debris. This causes redness, warmth, and swelling, signaling active healing. Inflammation typically peaks within 20-48 hours, but should fade as new tissue forms. Prolonged or excessive inflammation can delay healing or increase infection risk. Now your body repairs the cut. Fibroblasts, tiny cells that build tissue, rush in, producing collagen to form a strong scaffold. Normally, this creates smooth scars, but if healing is uneven due to genetics or tension, fibroblasts overproduce collagen, leading to raised keloids or hypertrophic scars. Meanwhile, epithelial cells crawl under the scab, restoring your skin barrier. Inflammation should fade, though persistent redness may signal issues. Keep wounds clean and moist for natural healing. Healing isn't just about letting a cut, so it's also about giving your body the right conditions to work its best. Nutrition plays a big role. Proteins like collagen and vitamins, especially C and zinc, help fibroblasts build new tissue faster. But if you're malnourished or have diabetes, blood flow slows, delaying repair. Hygiene matters too. Washing hands and cleaning wounds keeps bacteria out, preventing infections that can stall healing. Over-the-counter pain relievers like ibuprofen, when used as directed, may reduce inflammation temporarily, but they shouldn't replace proper wound care. Always follow label instructions or ask a pharmacist if unsure. Standard care, keeping the area clean and moist, lets your body focus on regeneration without interference. Most cuts heal with a faint scar, your body's way of rebuilding tissue. But sometimes healing goes off track. Keloids form, raised, fixed scars that grow beyond the original wound. Unlike normal scars, they're caused by overactive fibroblasts, the cells that build new skin, and are more common in people with darker skin or a family history. They're not harmful, but can be itchy or painful. If a scar feels lumpy, grows larger than the cut, or doesn't fade after 12 and 18 months, see a doctor. Standard care, keeping wounds clean and moist, still applies, but treatments like silicone sheets or steroid injections, prescribed by a clinician, may help soften keloids. Avoid picking at scars. It can trigger more overgrowth. Let's clear up some myths about cuts and healing. One common belief is that leaving a cut open to air helps it heal faster, but this isn't true. Keeping the wound clean and moist actually supports better regeneration without interference. Another myth, that scars always fade over time. While most do, keloids, raised, fixed scars caused by overactive skin-building cells can grow beyond the original wound and may not soften on their own. If a scar feels lumpy or keeps growing, see a doctor. Standard care still applies, but treatments like silicone sheets, non-prescription, or steroid injections prescribed by a clinician can help. Avoid picking at scars. It can trigger more overgrowth. If your cut feels hot, throbs, or oozes pus, signs of infection, see a doctor. Swelling that doesn't shrink after cleaning or red streaks spreading from the wound are also red flags. While most cuts heal cleanly with standard care, cleaning and keeping moist, infections need professional treatment to prevent complications like abscesses or cellulitis. Avoid picking at scars, as this can worsen healing. If a scar grows beyond the original cut or stays raised for over 12 to 18 months, consult a clinician for treatments like silicone sheets or steroid injections, though these require prescription and evaluation. To prevent cuts and support healing, wear protective gear like gloves when handling sharp objects. Clean wounds immediately with mild soap and water to remove debris. Apply a thin layer of antibiotic ointment, like Neosporin. If needed, it helps protect against bacteria without prescription. Keep the wound moist with a non-stick bandage for 1-2 days. Then let it air out unless it's still healing. Avoid picking at scabs or scars. It can disrupt new skin growth and lead to overgrowth. If you notice signs of infection like red streaks, swelling, or pus, see a doctor. While most cuts heal cleanly with standard care, some may form raised scars, keloids, that don't soften on their own. If a scar keeps growing beyond the original wound or feels lumpy after 12 to 18 months, consult a clinician for evaluation, though treatments like silicone sheets or steroid injections require prescription and professional assessment. Over-the-counter OTC medicines can help with pain, itching, or infection prevention, but they're not always necessary for cuts. Antibiotic ointments like Neosporin protect against bacteria when the wound is dirty, but they don't speed up healing for clean cuts. Always follow label instructions to avoid mistakes. If a cut feels worse after using OTC products like more redness or swelling, stop and see a doctor. These medicines are safe and effective when used correctly, but they're not a substitute for proper wound care like cleaning and bandaging. Healing isn't just about your skin. It's also shaped by stress, sleep, and where you live. Chronic stress weakens your immune system, slowing repairs, while deep sleep helps tissues mend faster. Urban pollution or poor hygiene can raise infection risks, but they don't cause wounds to heal worse on their own. These factors aren't just background. They influence how well your body recovers over time. Your body is constantly working to repair itself after a cut. But healing isn't just about the wound. It's also tied to your overall health. Stress can slow down recovery by affecting your immune system, while good sleep supports tissue repair. Pollution or poor hygiene may increase infection risk, but these factors don't replace proper wound care, like cleaning and bandaging. Always follow label instructions for over-the-counter products. And if a cut feels worse, like more redness or swelling, stop using them and see a doctor. Your body's repair system is impressive, but it works best with the right care. Remember, this is general health education, not personal medical advice. For individual